In today's video, we want to go over 3 important things to keep in mind when it comes to physical agent modalities, also known as PAMs, in relation to occupational therapy. Physical agent modalities can include things like hot packs, cold packs, paraffin baths, fluidotherapy, ultrasound, and so forth. The first thing to keep in mind is that these modalities are not appropriate if they are used in and of themselves without an activity or occupation in mind. For example, if somebody comes to you and says, I want more range of motion in my fingers, or I want more movement in my fingers, and the goal is just for movement, that falls short of what we do as occupational therapists. There always has to be an occupation or activity that is meaningful to the person in mind when we're doing these interventions, which is point number 2. These modalities are incredibly important when it comes to either preparing for, supporting, or enhancing certain occupations for certain people. Therefore, PAMs serve a very important role in occupational therapy, but they have to be tied to an activity or occupation. And that's why the OTPF-4 does reference PAMs as an important intervention, specifically under interventions to support occupations. The description for this is methods and tasks that prepare the client for occupational performance are used as part of a treatment session in preparation for or concurrently with occupations and activities, or provided to a client as a home-based engagement to support daily occupational performance. These interventions to support occupations can include PAMs and mechanical modalities, which the OTPF outlines in more detail. It also includes things like orthotics and prosthetics, assistive technology, environmental modifications, wheeled mobility, and self-regulation. All of these intervention types that's listed in the OTPF help to support occupations and a person's participation in those occupations. Therefore, if somebody comes to you and says, I want more range of motion in my fingers, or I want more movement, the very important question for us as occupational therapists to best help a client is to say, okay, I understand that you want to increase movement. What are the things in your life that is difficult right now for you to do because you don't have the movement? That ties that range of motion goal that the patient may come with to a specific occupational outcome, which is definitely within our realm of expertise, and the reason we are experts at activity analysis, and hopefully will also allow us to help the patient not only achieve the range of motion, but ultimately be able to do something that's meaningful and exciting for them. So a good example might be somebody who wants to play piano again, but had an injury that limits their finger range of motion. A hot pack before playing or starting some activity to support that occupation might be a great intervention for that person. And the third thing to keep in mind is that states and countries have different standards as far as when can a practitioner use these modalities safely and effectively for clients. So for example, some states have certain CEU requirements that a person has to attend before they can practice using physical agent modalities. So keep that in mind when you are using these modalities, because there are contraindications and precautions that you want to be aware of. So if you're a new practitioner or somebody just entering the field, would highly recommend taking a CEU course that might give you a greater understanding of how to use these different modalities to best help your patients or clients. As always, thank you for watching the OT Minute. I hope this was helpful. We hope to see you in the next video.